Hello everyone, I am Immi from INC Group 2, and now we will present our case study for CPN 1.
And this is our case reason. The patient initial is Mrs. A, 61 years old, medical record 9621, medical diagnosis diabetes mellitus, suspect community acquired pneumonia, benign proximal positional vertigo, and dyspepsia. And the unit name is IPD 605 2, and admission date is 26 September 2025, and the skill date is September 27, 2025. And our supervisor name is Ibu Nurse Septa Mariana Lumbantoruan SKP MS.
Health history assessment. Health current major complaint. The patient was taken to the hospital due to sudden weakness and shortness of breath. The patient also complained of frequent thirst, frequent urination, nausea, and difficulty maintaining balance while standing.
So here's the patient condition for nursing problem blood glucose instability. The data subjective is the patient reports feeling easily thirsty. She said, I now get tired easily even after walking a short distance. She also said my mother also had diabetes. The patient reports drinking tea up to twice a day, consuming sweet foods, fried foods, and junk foods such as instant noodles. The patient also has irregular sleep patterns. And for the data objective, the patient's blood sugar level have increased. For 26 September 2025, it's 259 milligram per deciliters, and for 27 September 2025, it's 307 milligram per deciliters. And for skin turgor, it's more than 2 seconds. And also the patient have dry oral mucosa. Patient's lips are cracked. And the BMI is 28.1, which is class 1 of obesity. And for nursing problem ineffective breathing pattern, the data subjective is the patient said, I've been feeling short of breath and having trouble breathing a lot this past month. And I think also patient said, I think I cough from my husband. And for the data subjective objective is a prolonged expiratory phase. During auscultation, the expiratory sound is longer and accompanied by bronchi, and abnormal breathing pattern, which is tachypnea 26 times per minute, use of accessory muscle breathing, visible contraction of the and rapid deep breathing accompanied by additional breathing sounds, bronchi heard during auscultation, and the pulse is 117 beats per minute, and EWS is 4.
And for the third nursing problem, that is risk of falling, the patient reports feeling weak and fatigue easily. And she said, when I get out of bed, I feel like the walls of this room are spinning. And also said, I fell once while walking in the afternoon. And for the objective data, the patient looked pale, blood sugar is unstable, appears unsteady when walking independently to the bathroom, false score based on Morsefall scale, 70 high risk, and history of fall in the past 3 months. Secondary diagnosis, left metacarpal, IV placement, and weak gait.
Nursing diagnosis based on priority. First, blood glucose instability is associated with impaired blood glucose tolerance, evidenced by the patient reporting excessive thirst and fatigue. Blood glucose levels of 259 until 27 mg per deciliters, dry skin, thicker skin turgor, and a family history of type 2 diabetes. Second, ineffective breathing pattern is associated with breathing difficulties, as evidenced by the patient feeling shortness of breath, tachypnea, prolonged expiration, use of accessory breathing muscles, areas of auscultation. Third, risk of falling is evidenced by history of falling, fatigue, and weak gait. For the rationale is high blood glucose levels is 259 until 307 mg per deciliters, increased risk of acute complications such as dehydration, diabetic ketoacidosis, and electrolyte imbalance, requiring prompt management to prevent a vital organ damage from American Diabetes Association 2024. In addition, symptoms such as tachypnea, use of accessory respiratory muscle, and loss of auscultation indicated ventilatory disorder that can lead to hypoxemia and respiratory failure if not addressed promptly. From Ernest Mayer and Chrisman, 2021. Meanwhile, fall risk is considered the third priority because fall prevention if intervention are more.
And here's the supporting data of our patient.
And this is the medication for the patient.
Interventions 1. Outcome criteria. After 1 times 6 hours of interventions, it is expected that the patient's blood glucose stability will improve. With following criteria, the patient blood glucose level decreased to 290 mg per deciliter. Second, reduce signs of dehydration, skin turgor less than 2 seconds. And 3 is moist oral mucose, being in color, not cracked, and appears moist. With intervention in hyperglycemia management, observations identify possible causes of hyperglycemia for correcting the underlying cause and preventing complications, monitor blood glucose levels if necessary for early detections of hyperglycemia and evaluate treatment effectiveness. Monitor signs and symptoms of hyperglycemia, example polyuria, polydipsia, and polyphagia. For identify hyperglycemia even before laboratory results are available. And we are recommended self-monitoring of blood glucose levels for recognize glucose fluctuations and adjust their diet and medications. We collaborate in administering insulin if necessary, because insulin is the primary therapy for lowering blood glucose in moderate to severe hyperglycemia. With collaborations in administering IV fluid and HL 0.9% required for rapid dehydration in severe hyperglycemia or ketoacidosis. Intervention 2. Outcome criteria. After 1 time 6 hours of intervention, it's expected that the patient breathing pattern improves with following criteria. First, respiratory rate within the normal range, 20 times breaths per minute. Second, decreased use of accessory breathing muscles. Third, decreased bronchi on auscultation. Fourth, decreased shortness of breath. 5. Normal expiratory phase. During auscultation, the expiratory sound is shorter than the inspiratory sound. Airway management. With observations monitoring breathing patterns, frequency, and depth. Early detections of changes in ventilations prevent respiratory failure and allows for rapid interventions. Second, monitoring additional breathing sounds, such as ronchi or wheezing. For monitoring additional breath sounds help detect airway obstructions, fluid accumulations, and bronchospasm. Therapeutic positioning in semipolar or polar positions. Reduce diaphragmatic pressures and increase lung expansions for optimal ventilation. And second, administration oxygen for nasal 2 lpm, maintain oxygen saturations, and prevent hypoxemia.
For the intervention scheme, outcome criteria, after 1 time 6 hours of intervention, it is expected that the patient flow rate will decrease based on the following criteria. First, for the score for NFS decrease score of 60 in MFS. And 2. No falls occur during treatment. And third, reduce complaints of dizziness. Okay. For prevention, for the observation, first, identify all risk factors. 2. Calculate for risk using the scale. For the therapeutic, first, ensure that the wheels of the bed and wheelchair are always locked. 2. Install bed handrails. Third, place the call bell within the patient reach. For the education, first, advise the patient to call the nurse if they need help moving. 2. Teach how to use the call bell to call the nurse.
Implementation. At 27 September 2025, the first intervention we do is at 7 past 10 a.m. Is ensuring the patient is in a 35-degree semi-polar position and checking the vital signs. The response is the patient complained of mild shortness of breath. The patient reports that shortness of breath has decreased after being positioned into the semi-polar position and appears more relaxed. The blood pressure is 118/76. The pulse is 88 beats per minute, is regular, and then respiratory rate is 20 breath per minute. And the SpO2 is 100%. The temperature is 36.7 degrees Celsius. The second implementation we do is at 8 past 10 a.m. Is checking pre-meal LBS, administering through 200 milli oral fluid, and educating family on the importance of limiting high sugar foods. The LBS result is 256, and the patient appeared tired, dry mucose. Patient approached tired and dry mucose improved after drinking 200 milli oral fluids, and the patient said they understood when educated about limiting high sugar foods. The third implementation we do is at 9 past 10 a.m. is ensuring that wheels are low and the call bell is within the patient reach at the right time. The patient response is the patient appears stable in the bed and the family understand how to use the call bell. The patient say they feel safe in bed and understand how to use the call bell. And the fourth implementation is at 10 past 10, ensuring that the patient remains in the semi-polar position, checking the vital signs and teaching patient how to cough effectively. The patient response is the patient said that he comfortable with the position and the patient report that the shortness of breath has slightly improved. The blood pressure is 112/74 and the pulse is 84 beats per minute and the respiratory rate is 21 breaths per minute. SpO2 is 100% and the temperature is 36.6 degrees Celsius. After being coughed effectively coughing, the patient can perform it with guidance. A stroke still needs practice.
And the fifth implementation at 11 past 10, checking the patient RBS and collaborating with the physician for non-rapid insulin administration according to medical orders, and educating the family about the warning sign of hyperglycemia. The patient response is RBS 243 mg per deciliter, The patient appeared weak after insulin administration. The patient stated he felt a little better, although still weak. No sign of adverse reaction such as swelling, itching, rash, or shortness of breath were observed while the sun remained stable. And for the rationale, to monitor blood glucose levels, ensure safe insulin administration as prescribed, and enhance family awareness for early detection and management of hypoglycemia. For the sixth implementation is in 1210, assisting and ensuring the use of the handrail, educating the family to always accompany the patient when moving. The patient responded. The patient appeared unsteady when sitting on the edge of the bed, but was willing to try again with assistance. The patient said they felt more confident when accompanied by family or nurse. And for the rationale is to prevent false promote patient safety during mobility and involve the family in maintaining a safe environment. And then for the last implementation is 1230 is providing a semipolar position and monitoring the vital sign. The patient complained of mild shortness of breath and the family stated that they understood the importance of maintaining a calm environment. The patient complained of mild shortness of breath which stated that they feel more comfortable after being placed in the semipolar position. The patient understood the family explanation regarding the importance of maintaining a calm environment. Blood pressure is 99 per 21 mm per Hg, the pulse is 65 beats per minute, regular 2 plus, and then for the respiratory rate is 23 breaths per minute, and then 8 irregular, and for the saturation is 100%, and for temperature is 35.6 Celsius. And for the rationale for the last implementation is to promote adequate lung expansion, improve breathing comfort, and detect early physiological changes through vital sign monitoring. And the all implementation is signed by Nurse Melvi.
Evaluations. This is the evaluations from implementation nursing diagnosis 1. The subject is the patient report feeling lighter and slightly better after receiving insulin and drinking 200 ml of water. And the patient also report that her mouth felt fresher and understood the nurse's explanation about restricting sugary foods. And the objective is the GDS value decreased from 256 mg per dl to 243 mg per dl after insulin. The previously dry oral mucosa appear more moist, the lips were no longer chapped, skin turgor improved, and vital signs were stable. And the next is the patient still appear weak but show no signs of severe dehydrations or allergic reaction. And A is assessment. After intervention, blood glucose instability has not been full resolved. And for the P is planning, continue monitoring blood glucose levels before meals and before bedtime, collaborate on insulin administration according to medical instructions, maintain education on low sugar diet, and the importance of adequate hydrations. And the last is re-evaluate glucose levels and signs of dehydrations every shift. Okay, the next is evaluations from implementation nursing diagnosis 2. The subject is the patient. Report that shortness of breath began to decrease after being placed in a semi-folder position and taught effective coughing techniques. And the patient felt more comfortable in a quiet environment. And for the objective, respiratory rate decreased from 26 to 21 until 23 breaths per minute. Use of accessory breathing muscle decrease, bronchi decrease on auscultations, SpO2 100%, and the patient was able to cough effectively with guidance. And for the assessment is after intervention, ineffective breathing pattern was partially resolved. And for the planning, maintain semifolder position, continue monitoring respiratory rate, breathing pattern, and auscultation findings every shift, continue effective coughing exercise until the patient is independent, and the last is educate the family to maintain a quiet environment and support the patient.
Next is evaluation for nursing diagnosis 3. For the subjective, the patient says she feels safer and more confident when assisted by nurses or family members when sitting or changing position. For the objective, the patient appears unstable when sitting on the edge of the bed, but is able to maintain balance with assistance. And the environment is safe. The bed walls are locked, the call bell is within reach, handrails are installed, and the family understand how to assist. There were no falls during observation. For the assessment, after the risk of failing intervention, the risk has not been completely resolved, but has been minimized, as evidenced by no falls during the intervention and improved ability of the patient and family to prevent falls. For the planning, first is maintain safe environmental modification, lock wheels, handrails, call bell. Next is they educate the patient and family to always ask for help before changing position. The third is monitor during mobilization. And the last is collaborate with the medical team for the patient vertigo management.
And this is our concept map.
Okay, you can see in the concept map, this is about the diagnosis 2 in infective breathing pattern, and the third diagnosis is risk of failing. Okay, thank you.